This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I was just cooking spaghetti and all of a sudden my leg started hurting. The pain was just excruciating.
Pain is a signal that something is not right. This is your back, so you got a little bit of a blip there, and right here you got a little bit of a blip, and here you got a good little blip. The spinal cord itself ends at about kind of upper part of the lower back. So you're going to feel a little stick here, right into the muscle. A little pressure here. Here we go. Imagine if you woke up this morning and you just couldn't move. I mean, you felt like your back was locked, you couldn't get out of bed, you were in excruciating pain. I mean, just imagine you're hurting so bad. I mean, a lot of us have had a toothache. And the toothache is there all the time. You can't eat, you can't chew, you can't drink, it just hurts. And this is the same thing, but it's in your back. First of all, you're trying to figure out what's going on, and you're trying to get a control of the pain. Then after a short period of time, you start thinking, gosh, what if I'm stuck with this for the rest of my life? You know, after the first couple of weeks and it's not really getting better, you're like, man, what am I going to do? I have a family, I have kids, you know, I have a job, I have a home. What's going to happen? What am I going to live on? That's the real problem. So pain is a signal that something is not right. You cannot practice medicine over the phone, not pain medicine. How you feeling? I'm having severe pain. How bad? 10 over 10, and you can't see him. You got to see him. You got to see him walk, you got to see him talk, you got to see him interact with people to know how it's impacting their lives. And I think that's critically important, what we do.
All right, Dolores, what I'm going to do is get some history from you
Okay.
of what happened.
My staff will do a full history of what happened, how it happened, have you ever had this before, what medications are you taking, and what treatments have you had.
How long have you been having this pain?
It was 2 weeks ago Sunday.
Okay, what happened?
Well, I was just cooking spaghetti and I had heels on and all of a sudden my leg started hurting. So I went and I sat down to take my shoes off and I couldn't get back up. The pain was just excruciating all the way down here.
Was it in the back at that time?
Yeah, it started right here and it kind of wrapped around and then just sharp pains right here.
Okay.
And now today it feels numb.
I've got a really good idea. I mean, I've got a 4 or 5 page document that tells me kind of what the history was. So I've got a good idea before I go in the room kind of what I think is going on with this patient. And what were you doing? Laura said you were cooking?
Yeah, I was just cooking spaghetti and all of a sudden I felt this real bad pain on my shin.
Going down that left leg? Cooking in the heels was not what caused her problem. She's trying to relate that because that's when she noticed it. You start thinking back. Was it that? Was it this? Did I pick up a paperclip? Did I turn in bed wrong? When I picked up my son? Was it because I closed the door on the trunk of the car? I mean, you start looking for a reason. I mean, it's crazy. There's people that won't even pick up their kids anymore because they're afraid that's what caused their pain. I mean, I've had patients that say, you know what? I don't want anybody walking in the house because every time you walk, the vibration makes my pain worse. It's a lot of things happen. You went to see the doctor, right?
I went to see the doctor, yeah.
And he put you on a Medrol dose pack?
Yes.
Steroids, right?
Steroids, yeah.
They give you what they call a Medrol dose pack. It's got a little list of how many days and how many pills to take, and you start off with so many pills the first day, the second day, and the third day. In some cases, they work very well. In most cases, they're going to help some. But when there's so much pressure on that nerve, it's not enough. And did it help or not?
Not at all.
Okay.
It just made me really hungry.
Okay. Well, yeah, they do. Steroids will make you eat anything you can find. All right. You've been off for about a week before that, right? You've had some other surgeries, some thyroid surgeries, something like that?
Thyroidectomy, yeah.
Okay. See, medicine works on what we call differential diagnosis. It's like working on a light. Okay, what's wrong with the light? The bulb doesn't come on. Is it the power? Is it the electricity? Is it the tube? Is it the bulb? You know, so many things. Now, had you exercised during that time or no?
No, I took 2 weeks off. The doctor told me not to exercise.
Okay.
So that week before is when I first started back.
And then you start asking questions that kind of direct you into this diagnosis. You want to funnel into a certain diagnosis if you can. Did you go on a trip yesterday? No. Have you ever had this pain before? No. So you work your way down to a diagnosis. Okay, so when you went back to exercise, did you exercise the day before this started?
I did Saturday.
Did you probably overdo it, maybe, or what'd you do?
Well, actually,
And then they'll tell you kind of what it was. They don't know it's what it was. You have to realize and observe that that's what it was. That's the practice of medicine.
I added more weights than I normally do.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I had it injured when I was helping my daughter play soccer. When I bent down to help her get a ball, my back locked up. And when it locked up, I couldn't move, couldn't sit, couldn't stand, couldn't walk. I like when they apply Dr. Carrasco's pain cream after my massage therapy. It helps me get through my physical therapy a lot better. Now I'm able to walk on a treadmill, keep my balance, do a majority of my therapies, and go home happy to my 3 kids. Dr. Carrasco's pain cream does work for me.
So I'm an ex-college soccer athlete. I'm still trying to live the dream. Most of the time I get pain the next day when I get sore. So I use Dr. Carrasco's pain cream on the back of my leg and in the front of my lower leg. Roll it on, apply it, and within minutes it works and I have no pain. I recommend it to athletes, the Dr. Carrasco pain cream, because it works.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
The guy who never exercised before will know to work. His stamina won't let him go at 5 miles. But these people are used to exercising 5 miles a day, so they think nothing happened in the last 2 weeks. Even though I'm just going to go back to my 5 level. That's how they overdo it. They don't realize that it took them years to work up to the 5 miles, and now 2 weeks later, they could still go back up to that level. That's how they tend to hurt themselves. I mean, when I treat professional athletes, it's the same way. You have to strengthen them back up to where they were at their pre-injury level. I want you to walk to that wall. By seeing a patient walk, you can tell whether their spine is equal or even. You can tell if they're limping. You can tell if the limp is coming from the hip or coming from the back. You can tell if it's coming from the knee or coming from the foot. I mean, that's really kind of the best way to kind of get us assessment of where the pain seems to be coming from. You do a general exam. We want to make sure the nerves are working okay. You'd hate for the problem to become from up high. These nerves are going down through this spinal cord. If I push on that nerve, depending on where it's at, I mean, the ones that supply the legs are in the middle of the spinal cord. But if you somehow have to put something pushing deep inside that spinal cord where those nerves supplies that leg, that could be the cause. Well, let's take a look at your MRI and see what it shows. But the orientation of an MRI, because it's mostly just shadows, is very difficult to kind of really get them to really understand what's going on in that picture. So this is kind of your spine here. This is the spine, this is your back. This is where the spinal cord is, this kind of dark area right in here. So this is a disc in here and here and here, all these little black areas. We're just going to follow it along and see what happens. And so you got a little bit of a blip there, and right here you got a little bit of a blip, and here you got a good little blip. But I think it's a good idea to show them, kind of gives them an idea that yes, there's something really going on, and this is kind of where it's going on. And it kind of reassures them that it's not all in their head, that they got something going on. That could be the cause of their symptoms. Here, see right in there? This is the disc part, and this is the spinal cord, and the nerves are right in there. The sciatic nerve is composed of several nerves come out of the lower part of the spine. And those nerves come together to create one nerve called the sciatic nerve. It runs kind of right down the middle of your buttocks. Now, if it had been a different nerve, it'd be going on top of the knee, not along the side of the leg. So that's part of the anatomy. We know where that nerve supplies. So when you have this pain or the pressure on this nerve up high, that pain goes right down your back, right down your buttocks, and into the leg. That causes a radiculitis. Radiculitis is kind of a sign or a pain going down the leg. Pain is the symptom, and those two signs and symptoms go together along with the location where the pain is, and we call that sciatica. The important thing is that that's there, and we can treat it. We treat this all the time. You don't need to have surgery, nothing like that. Let's treat it conservatively first. And everything you do has risk, and so you minimize the risk-benefit ratio. I mean, you can go in there. I've had patients that have one surgery, and they've had a surgery, didn't get better. Maybe it was this other level, so we do another surgery, didn't get better. An epidural steroid injection is done very commonly for patients with this kind of problem. It's what it says, it's an epidural space It's a space kind of in the lower part of the back, outside the spinal cord, not in spinal fluid, but right outside of that. Epidural steroid, because it's going to give you a steroid, and it's called an injection. This procedure looks very benign and very simple. I mean, I've done 20, 30,000 of these, but there are risks. The chance of those things occurring is not very often. But the spinal cord itself, as an actual cord, ends at about L1 or L2 in the kind of upper part of the lower back. Like in her case, in most cases, the problem is the lower part of the spine, so we inject in here. It's a lot safer there. The risk of injury to the nerves, paralysis, and death are there, but those, again, very minimal. It's all based on technique. Some patients will go to the doctor kind of leans you over the table and numbs up the area, puts a needle into there, and does the epidural injection. But it really doesn't have an idea exactly what level it's going into and what side of the spine of the cord you're injecting. And you cover this up and you put this needle, you don't know if you're over here on the right side or over here on the left side. The x-ray machine that we use actually gives us pinpoint accuracy. I mean, we know exactly where we're at, what part of the spine, what level of the spine, and which side of the spine. We can actually tell you which nerve we're injecting here. That's how good it is.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
The Carrasco Pain Institute was established in 1992 by Dr. Arnulfo Tarin Carrasco and is housed in a beautiful 16,000 square foot hacienda located in the prestigious South Texas Medical Center in San Antonio, Texas. The Institute is staffed with caring and compassionate medical professionals, and the on-site surgical suite is state-of-the-art, equipped with the latest imaging technology. Our rehabilitation department helps patients return to a more productive, satisfying, and independent lifestyle. The medical spa provides a beautiful and relaxing environment, promoting health, hope, and healing. Our in-house studio is home to the Emmy Award-winning Dr. Carrasco Show. We invite you to visit us at carrascopaininstitute.com or call 210-614-4825.
Good. Now you're going to give you just a little bit more for some of the discomfort. You may have a little bit of pain, so I'm going to give you something for that. Some doctors say, well, they don't need an IV. It's a simple procedure. Well, we ask people not to eat, so they're already low on fluids. So we need to give them some fluids. Plus, I mean, it can happen. You could get an emergency situation. You want to have IV access. You want to be able to have something you can give them medication through. We'll clean it off 3 good times. You okay? You feel comfortable?
Yes, I'm good.
Okay, good. Patty, let's put this on here. You're gonna feel some towels on your back here. All right. I'm just gonna clean it off here a little bit. How's she doing? Good. All right, let's take a look here, Tom. So what we want to do is use confirmation again with X-ray guidance. Stop. Right, here we go. Fluoro, Tom. Good. We can palpate the skin and kind of know where we're at, so to speak. But there's nothing better to using a pointer to kind of identify the spot. All right, I'm going to mark on your back here, Dolores. Here, we're actually going in here and decide, well, this is L4 and this is L5. Let's put the needle right in there. So we're looking at this image like this. We place this over the skin. Using this pointer, we'll identify or mark the area we're going to do the injection. Now the next step is to numb up the area. I mean, we're still going through the skin. So we place a small needle and use it to kind of numb it up through the skin as much as we can. You may feel, boy, that's hurting all the way down, but it's really not. Just the very tip of the skin is where they feel the pain. Once you get through that skin, the pain fibers are much less dense, so they don't feel as much discomfort. A little pressure here. Here we go. Little stick. We actually want to advance that carefully. We want to make sure that we don't go too far or too shallow. Now, it's all done by feel as far as the location. Okay, you're going to feel a little pressure here. Good. Once we advance it now, we use what we call a glass syringe. The responsibility of the glass syringe here is to try to get what we call a loss of resistance. Once you're advancing this needle in there, and you feel a loss of resistance that needle actually gives, you know you're where you need to be. All right, I'm gonna inject a little ice of you here now. Go, Tom. Good, stop. And this was on the left side like we wanted to. There it is, there's the medication, stop. Okay, magnify it one time, Tom. And you can tell down here is a spine, is a bone. In here, the nerves will come out of this little hole, and the actual back is up in this area. All right, now we're going to inject the medication. A little pressure here, honey.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I've had low back pain for 4 years now. When I use Dr. Carrasco's cream at work, I'm more functional because I sit all day. I get up and I roll it on just right there, and it really helps.
My daughter likes to use Dr. Carrasco's pain cream when she plays volleyball. Really helps her range of motion when she goes to perform. All my family uses it.
I'm using it all down my leg. I'm using it on my back. I didn't think that it was going to help me the way that it has, but it has actually given me a lot of relief. You don't have to keep reapplying and reapplying. That's how good it is.
I bought it for Judy when she has some spasms. She sleeps a lot better. It really works, and it helps her out, and it also helps me out.
I love Dr. Carrasco's pain cream.
Dr. Carrasco's pain cream helped me sleep all night.
Because it does work.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
Good. All right, now I'm going to flush it a little bit. Once we confirm where the needle needs to go, we'll inject the steroids into the area, and we flush it with some saline or some local anesthetic to kind of make the area a little bit numb, but also spread the medicine in the spinal canal. And we're done. Perfect. Now I want to inject some of these muscles that are kind of sore. You got a lot of spasms. See, all these muscles are tight. I can tell by feeling them, they got some knots in them right in there. Now the other thing that many patients we talked about earlier, they have muscular pain, and that's what I'm feeling for. So you're going to feel a little stick here right into the muscle. Okay? Once we identify the areas of muscle spasm, we're going to put a little bit of local anesthetic, or numbing medicine, a little bit of steroids into those areas. Try to stop the muscle spasm component, or the Charlie horse component. You know, most muscles are somewhat long. We want to try to get the needle in this way, and that way, and that way, and that way. We're actually not pumping the needle, we're actually see us reposition the needle. We try to inject it 4 quadrants to give the highest likelihood of covering that same area of pain. Here's one, right there. Feel that one? And the last one here. Okay, all done. Everything went great. She's going to clean you off here a little bit. In this case, the injections took care of it. I think early recognition and early treatment is the best way to make sure that you can minimize the results of this thing long term. So in most cases, like I said, 80% of people in 6 to 8 weeks are going to get better. But when they don't, you have to kind of reanalyze what is the problem. Did I miss something? Is there something else that we're not seeing here before you go into surgery or other options? I've had patients that took very little treatment and got better. But there are patients out there who develop chronic pain. For whatever reason, they are never going to get better. You know, back pain is so common, and back pain doesn't know any barriers. I mean, I've treated, you know, homeless people, I've treated billionaires. I've treated, you know, professionals and non-professionals. I've treated, you know, that are blue-collar workers and white-collar workers. There are some people that we have to look at the fact that they have secondary gains, or they don't like their job, or they have personal relationships within their family, or their wife, or their husband, that pain becomes a good excuse. Because of my pain, I don't have to go to work. Because of my pain, I don't have to be nice. Because of my pain, I don't have to go to church. Because of my pain, I don't have to do. So it gives you a lot of excuses. There are patients you say, well, how bad is your pain from 0 to 10? And the guy could be sitting just like I am now, so it's a 10. Well, you don't look like a 10. You look like you're probably maybe a 1 or a 2. I have patients come in here that are farmers or that have never been to the hospital much at all, never taken much medication. They come in there and their fingers smashed to death. How bad is your pain? 2 over 10. 10's the worst pain in the world. It's a 2. We know, and I understand, and I agree 100%, that I can never tell you whether you have pain or not. And I can never judge how severe your pain is. We just can't.
The Carrasco Pain Institute was established in 1992 by Dr. Arnulfo Tarin Carrasco and is housed in a beautiful 16,000 square foot hacienda located in the prestigious South Texas Medical Center in San Antonio, Texas. The institute is staffed with caring and compassionate medical professionals, and the on-site surgical suite is state-of-the-art, equipped with the latest imaging technology. Our rehabilitation department helps patients return to a more productive, satisfying, and independent lifestyle. The medical spa provides a beautiful and relaxing environment, promoting health, hope, and healing. Our in-house studio is home to the Emmy Award-winning Dr. Carrasco Show. We invite you to visit us at carrascopaininstitute.com or call 210-614-4825.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
Those patients, they go through a grieving phase. You know, they go from, gosh, do whatever I can do, make me better, to anger. They're mad. Why does it happen to me? Why don't I get better? I mean, everybody else has gotten better. Why is it that everybody thinks that I'm faking? So they go through this kind of 7 stages of dying, so to speak. They go through anger. They go through depression. They go through, give me all the pills you can give me, to I don't want any more pills. I mean, until that patient decides that, look, this is going to be your life from here forward, and we have objective data, but it's okay. Many times patients suffer. I mean, some patients, you know, for suicide because they just can't take it. Pain goes beyond the physical manifestations. Initially, that's the primary focus. But all the other pressures, socioeconomic pressures that come along with pain and the inability to function on a daily basis, it affects all of us. It affects you. Especially if the pain becomes chronic, go see a psychologist to see how you're dealing with the pain and how you're coping with the pain and how it's impacting you and your life. What's going to happen to you? What happens if you've been hurt now, you're a young professional, or whatever your career was, and now you see yourself at the age of 25 or 30 or 40 or 50 with great dreams for yourself, all of a sudden you can't work anymore. You can't stand for 15 minutes. So there's a lot of pressure, and I say this in the most caring way possible, that when someone has pain, their soul is hurting. Their whole soul is hurting. I mean, the weight of your family and your future sits on you. And so I am telling people that find as much as you can, seek the best medical care you have. And what we're trying to tell people, if you have pain, talk to your doctor. Don't sit at home and, well, the doctor said there's nothing you can do. Maybe there's nothing that doctor can do. But it doesn't mean there's nothing somebody else can do. I see these people suffering, man. And I see these people suffering with pain. And there's nothing more frustrating than not being able to help them. Well, how do you help them? Well, you're doing all you can. And there's so many forces that are with you or against you. How do you decipher through all that? I mean, it takes a lot to figure out objectively how can I help that patient. And I think that's the take-home message today. That you're treating a person whose soul is hurting. And you're treating that whole person and their whole family, maybe for generations to come. And you've got to decide when to treat them and when not to treat them. And where do you stop? First, do no harm. Okay? But get them as good as they can for themselves, for their families, and for their futures. You have to. Hello, I'm Dr. Carrasco. How can I help you today?
For more information and videos regarding painful conditions, visit our website at CarrascoPainInstitute.com and drcarrascoshow.com. And I invite you to like, subscribe, and leave your comments.